Hello, friends. Thank you for joining me for another bonus episode in the series in which I'm sharing our family's experiences in the last year of our daughter Hannah's life, which spanned from February 2008 through February 2009. My desire is to process through the events of those 12 months with a perspective that 16 years has brought, and to point listeners to hope in Jesus along the way. I'm grateful you've joined me. This is bonus episode number 91. Temporary Isolation. Late July 2008. Hannah was amazingly patient with the various aspects of her regularly scheduled appointments at Children's Hospital. She didn't love being repeatedly poked as the nurses searched for a good vein, but she never complained. Nor did she enjoy having her blood pressure taken. In fact, it was quite often high because of the stress related to the blood draw, but she patiently put up with it, even when it had to be taken more than once to get a reading within the acceptable range. She smiled her way through all the routine questions she was asked at every appointment. But she hated the antibiotic breathing treatment she had to endure every month. This was no inhaler or nebulizer type breathing treatment. Hannah had to sit in a hospital bed or on a chair, be zipped into a plastic tent, and breathe in some sort of foul-smelling and apparently foul-tasting medication for about 30 minutes. The tent was transparent, so we could see each other when she was in there, and we could talk to one another if we raised our voices a bit. I'm not sure why she hated that treatment so much, but I have a suspicion. It was obviously unpleasant, but so was most of what she went through during that year. The purpose of the procedure was to prevent a certain type of pneumonia to which she was susceptible due to her chemotherapy regimen, and I know she thought that was silly. She never believed she would get pneumonia. I suspect that what really bothered her was how isolated she felt sitting in that tent. For those 30 minutes each month, she could do nothing but sit inside that tent, breathe, and think. While sitting surrounded by plastic, I believe she keenly felt the separation that existed between herself and the rest of the people in her world. The isolation of being a teenager with brain cancer became a little more real. Finally, the tent would be unzipped and she would be freed from her temporary prison. She would sputter around for a few minutes to clear the remnants of yuckiness from her nose and mouth, and then her good humor would return. Another month's breathing treatment down. Just another step in the process of accomplishing our goal, a cure for Hannah's glioblastoma.